Concerns tonight about pregnant women contracting COVID and the threat it poses to their unborn babies. Today, the CDC urged all pregnant women to get vaccinated.
And tonight, News 4's Emma Hogue is talking to Mercy Hospital, who says they're seeing more pregnant women become critically ill.
As a mom, you want to do everything you can to protect your baby.
It was a moment these college sweethearts had looked forward to for years. In October, Jacqueline and Dean Sindel found out they were expecting a baby in June, but a pregnancy in the midst of a pandemic came with added worry.
It was crazy. So my husband is actually an ICU nurse, and so we had the threat of COVID actually coming into our home regularly because he's caring for COVID patients. So we took a lot of measures within our home to, keep things clean, limiting what we're doing.
Aside from masking, sanitizing, and social distancing, Jacqueline and her husband knew they wanted the vaccine. Jacqueline, who works in social media for Mercy, says getting the shot last winter while 20 weeks pregnant was a no-brainer.
They were saying that they were believing it could pass along antibodies to the baby. I was planning on breastfeeding. I knew that would be a great thing for her and myself.
The COVID illness that we're seeing right now in our pregnant patients is much more severe than the illness we saw a year ago, and it has us really worried.
Dr. Laura Vricella works in maternal fetal medicine at Mercy and says a growing number of unvaccinated pregnant women are getting critically ill and winding up on breathing machines in the hospital, most likely due to Delta.
We've had to deliver several women prematurely, and that really makes the beginning of life much more difficult for their babies. It's also incredibly stressful for the women because they can't be near their babies because they're too sick.
And Dr. Vricella says even mild COVID cases in unvaccinated pregnant women could be detrimental to their babies.
Several of them have come back with stillbirths. And this is even more worrisome because it's a sign that even if it does not make the woman critically ill, it can still affect the placenta and cause her to lose her baby, which is just devastating.
A vaccine that helped protect Jacqueline's life, and now her 2-month-old Stevie's life too.
Please get the vaccine as quickly as possible.
It's good for you, it's good for your baby.
If you get the vaccine while you're pregnant, Dr. Vricella says there's a high likelihood those antibodies will get passed on to your baby, giving them some degree of protection for the first few months of their life. Reporting in Creve Coeur tonight, Emma Hogue, News 4.